I am so excited tonight. On today's live stream, we are going to be doing infant CPR and child CPR and also covering choking basics. And I have a special guest right here on my channel, so stay tuned. For those of you who don't know me, my name is Linda Poirier. I help mummies from all over the world and all ages fit back into their jeans, get their sexy back, and find a life of happy. Now, before we get into it, I do want to give a special shout out to Bella Kidd, who I just got a notification that she actually donated to the channel. This is my first ever donation, and so I wanted to give a shout out. We super appreciate it, and the live stream didn't even start yet, so yeah, thank you so much. And for those of you who don't know what Super Chat is, all that is right in the comments where you're about to say something in the live chat. There's a little dollar sign there, and that's what Super Chat is. I had to learn it myself. It is just something where if you do donate, it highlights your comment or your question, and we'll be able to see it, and you'd get first priority because it does highlight it, and obviously you donated, so we appreciate it. And you can also comment. We are taking Q&A throughout the course, so stay tuned for that. Now, just going to check in here, and I want to welcome those who have just joined, and thank you so much. And let me know also in the chat where you're from and what you want to get out of this course. Obviously it's to learn, but I'm really curious. So and I can see from here, I have my computer. So yeah, if you just want to say your name, welcome, welcome, welcome. All right, and if you haven't subscribed already, please hit that subscribe button below and be sure to click that notification bell so you can see all my other videos, because I am pumping out a ton of them. And also, if you like this live chat or live course and you want to see me do more lives, more learning, be sure to click that like button so that I know that you want to see more. All right, so let's see. Oh yeah, and then if you are asking questions, whether it is this live stream or if it's in the replay, you can just ask below and I get to every single comment. And because this is a special guest as well, that he will be also answering these questions when it's not the live stream. And he'll be answering obviously live, but in the comment section. All right, so now for my special guest. My special guest this evening is my husband, Craig. He has been a paramedic for 18 years, and he still is a paramedic, and he also owns a company called TinyTotsCPR, where he helps mummies and daddies in the comfort of their own home learn these life-saving skills in how to change or how to save their child's life. And so he's been doing that for a few years now, and people really, really love it. So I am so grateful and so thankful and excited that he is here tonight, and he offered this absolutely free on the channel, and I know you guys are going to super love it. All right, that being said, now, if you don't see me on camera, it's because my hubby Craig is coming on camera, but I will be in the chat so that you can see me, you know, interact there, and then he'll be on. So if you're wondering why I look like a boy now, it's because it's my husband on. All right, so let us begin. Here is Craig. We're gonna pass it off and he's gonna start. All right, I'm gonna give him my microphone because we are sharing. Sharing is caring.
Sharing is caring.
Okay.
Teach that to Preston.
There you go. All right.
Oh, my back's gonna get sore after sitting on this table. My instructor table. All right, so hi guys. My name's Craig, and like my wife was saying, I'm owner of TinyTotsCPR. And tonight I'm going to be teaching CPR. A little bit about myself. I've been a paramedic now for about 18 years. And in that 18 years, I've obviously done and seen quite a bit. I've also done and seen quite a bit of pediatric emergencies as well. Most of the time, those emergencies, they turn out just fine. You know, kids and people were very resilient, and you know, we can withstand a lot. But unfortunately, there are those other calls that, you know, they don't turn out okay. And that's just kind of the nature of what I do. And so I always thought to myself, you know, why don't parents know how to do CPR? Why don't they know how to deal with a choking situation? And then, you know, about 4.5 years ago, I had my own child, and I quickly realized that parents just don't have the time. CPR courses now, especially infant and child CPR courses, they're about 16 hours long, somewhere halfway across the city. You got to get a babysitter, they're expensive. So I just kind of designed my program around making it super convenient for parents to learn this stuff because, you know, helping people and being a paramedic and saving lives is kind of my passion. So as we go through here, I'm going to kind of list the order in a second here of what we're going to be doing. And I want you to know we're going to be kind of doing it in sections to keep it nice and neat and nice and clean. Okay. And after each section, if you guys have a question pertaining to that section, please feel free to ask. Write it down on the notes there, and we'll definitely get back to you between each section. I'll try and answer as many questions as I can between all the sections. So the order that we're going to be doing it in, the first thing we're going to be talking about is how to assess your baby's breathing. Okay, and this is probably the most important skill as a parent you could learn. Okay, so I'm going to show you guys how to do that and why it's important. Okay, the next thing we're going to be talking about is going to be infant CPR. Okay, then we're going to do child CPR. Okay, and just so you know, an infant is about 0 to 18 months. Okay, and a child is 18 months to about 9 years. And don't get me wrong, babies and kids are all different sizes, so there are gray areas there. Like I always say, I always recommend practicing what I'm teaching you. You know, literally pick your kid up, test it out, see if you can do some of the skills on them. I mean, obviously don't crush their chest or anything like that, but you know, hold them in your arms. Can you do some of the stuff, or are you going to have to do some of the modifications, right? So if the time actually does come that there's a choking incident or you need to do CPR, you know exactly how to do it. You know the modification that you need to do, rather than kind of doing that trial and error thing to start off with. So, infant CPR, child CPR. Then we're going to be doing infant choking and child choking. Okay, so those are kind of the 5 things. Okay. Breathing assessment, infant and child CPR, infant and child choking, okay? And like I said, after each section, I'm gonna be answering all the questions for you guys, if you guys have any. So, yeah, so to start off with, I guess, are there any questions? Does anybody have any questions or comments before I even get started on breathing assessments?
Karina's on here, and she just said she really wants to learn what to do in the case of my toddler choking.
Oh, okay.
So you did mention that we were going to cover that, and I'm sure you can hear me. I should go in camera a little bit. Thanks again, Karina, for the super chat. We really appreciate it. And Craig will be covering the toddler choking. I know that's every mom's nightmare is the choking, so he will get to it. And
I'm going to go over that in detail. Yeah. Believe me. Okay. Any other questions, or am I good to go?
Go ahead.
Perfect. Okay, so the first thing we're going to learn is how to assess your baby's breathing. Okay, the reason why this is so important is because we as adults, okay, we breathe at a rate of about 16 per minute, right? I take about 16 breaths per minute. I take them slow, I take them deep. Okay, if I'm in distress, right? If an adult is in distress, I can spot it across the room. Anybody can spot it across the room. They're hyperventilating, they're breathing too quickly, they're breathing too shallow. We're really very overly dramatic about it, okay? So it's easy to spot, but with infants and children, especially with infants, okay, their breathing rate is already very fast. So an infant under 6 months is gonna breathe at a rate of about, give or take 50, okay? 50 to 60 breaths per minute. After the 6-month mark, it goes down to about 30 to 40 and kind of goes down from there, okay? Give or take, right? Those numbers are never exact. The more active your baby is, the faster they're gonna be breathing, a little bit on the higher end. If they're resting or if they're at sleep, the breathing, of course, is gonna be a little more on the lower end, and that's okay, okay? But what we're gonna do is the first thing we wanna do is learn what our baby's normal respiratory rate is, okay? And that's very easy to do. All we're gonna do, we're literally gonna look at their chest, go up and down, Okay, as soon as it goes up and down, that's 1 breath. Okay. Again, it's going to be shallow. You might have to take their shirt off. You know, I would suggest do this when they're sleeping or napping in your arms or on your lap, or the first bunch of times, just to get used to it. Okay. So expose their chest, watch their little chest go up and down nice and small. Okay, every time they take a breath, that's 1 breath. Okay, or every time the chest goes up and down, that's 1 breath. Okay, so what we're gonna do, we're gonna take our watch and we're gonna count for 1 minute. Okay, we're gonna just put the timer on for 1 minute and count how many breaths they take. And that is their respiratory rate. Okay, so the little Billy here, his respiratory rate's, I don't know, probably 48 per minute or so. Okay, so that's really important to know. We're gonna get an average. We're gonna do this often. We're gonna do this especially when our baby is nice and healthy. Okay, so do this daily for months and months and months. Okay, the reason for this is we want to train our eyes on when our baby is breathing normal. We want our eyes trained so we can look at our baby for 5 seconds and we know they're breathing normal. Okay, like me as a paramedic, my eyes are trained. I can just look at someone for a couple seconds and I know whether they're breathing normal or not. Okay, you as a parent, you can't, or you might not be able to, right? So get to know your baby's breathing. Really watch them breathe. Okay. So when they're healthy, they're going to have a nice respiratory rate. Okay, when they're unhealthy, so let's pretend that they choked on breast milk, or they're choked, you know, they were taking a bath and they accidentally dipped their head under the water, okay, and they inhaled some water, they aspirated some water, okay. Believe it or not, this can be very deadly for babies. They can actually drown from this, okay. It's called dry drowning or secondary drowning, okay. But what you're going to see, I'm sure it's probably happened many times before for you by now, where they kind of inhaled a little bit, they coughed it up, 3 or 4 seconds later they're kind of back to normal, their breathing is normal, they're back on the breast or the bottle, you know, getting their fluids in, and they just kind of return to normal. Perfect, that's what we like to see. Okay, but what we don't want to see, okay, when we can tell that our baby is in respiratory distress, what we're going to see is we're going to see a consistent cough. That's probably the first thing we're going to notice. Okay, they're not just going to cough once or twice and get that fluid up. They're going to have a consistent cough for 30 seconds, a minute, 2 minutes, 5 minutes. It's just going to keep on going, right? What's happening is they inhaled some liquid, and instead of being able to get the liquid out, the liquid is now pooling in the bottom of their lungs. Okay, now remember, these babies don't have the same type of musculature that we have. So when we inhale something, we can get it all out, no problem. But a baby's lungs are very small, okay, and there's not a lot of muscle surrounding it. So it's very easy for fluid to get trapped in there. And what happens when liquid gets trapped in the lungs, the oxygen saturation goes from 100%, which is what we like to see, goes from 100%, and it starts to go down. 95%, 92%, 90%, okay? Depending on how much water is in the lungs, okay, the oxygen saturation is going to drop really slow or really fast. Okay, the more water, the faster it's going to drop. Okay, so we don't want to see that consistent cough lasting longer than, you know, even a couple seconds, probably 10, 20 seconds. Make sure that cough stops. If the cough doesn't stop, okay, count the respiratory rate again. Okay, what is it normally? Is it normally 48? Okay, now we're going to look at it, see how he's breathing, and now we notice that it's up around 80. Well, 80 is way too high. Anything above 60 for a child, for an infant, is way too high. Okay, so if it's like, you know, 70 or 80, when it's normally 40 or 50, you know it's way too fast. Their body's really trying to suck in that oxygen. Okay, so consistent cough, increased respiratory rate. The third thing we want to look for is something called indrawing. Okay, so we're going to lift our kid's shirt up, and right at the bottom of the rib cage where the sternal notch is, okay, when your baby takes a breath in, the skin is gonna get sucked in under the rib cage. Like that, okay? That's called indrawing, okay? And when we see indrawing, that's fairly severe distress, okay? It's one of the kind of a fairly major sign of distress, okay? So those are the 3 major things, okay? The fourth thing, now this is something that we really don't like to see, okay? And this is kind of the final thing we want to look at. Look at our baby's lips. Are they pink like normal, or are they turning blue? Okay, if your baby's lips are turning blue, that means their oxygen saturation is declining way too fast. Okay, if their lips are nice and pink, that means their body is compensating fairly well. okay, which is a good thing, but you still should call an ambulance, okay? If their lips are turning blue, going pale, turning blue, you call an ambulance right away. Your baby's oxygen saturations are going down, and your baby's going hypoxic. It's only a matter of time until your baby goes unconscious on you, okay? And that's obviously what we don't want to see. So yeah, learn how your baby breathes, okay? Watch them breathe, okay? I'm going to tell you a little story about why that's so important. I responded this about 7 years ago. I went to a lady who had a 9-month-old child who was breastfeeding, and the baby aspirated some of the breast milk into the lungs. And over the course of 2 hours, the mom really didn't know. And don't get me wrong, I am not blaming the mom whatsoever. But the mom didn't know what was going on, and 2.5 hours later, she finally called 911 because her baby was in cardiac arrest. And so what happened was, like I was explaining earlier, the milk settled in the lungs, couldn't get it out, and unfortunately, the oxygen saturation over 2.5 hours is very slow. Just kind of declined and declined and declined. You know, and if the mom only kind of knew what to look for, the signs and symptoms to look for, it could have, you know, turned out a little bit better, but unfortunately it didn't. So luckily we were able to get the baby back before we got to the hospital. The baby mom called just as the baby was going into cardiac arrest. We got there just in time. We were just down the block, literally, and we were able to get the baby back. I think the baby was ICU for a very long time though, because obviously hypoxia is not good. So anyways, learn how your baby breathes. Like I said, anytime they inhale something, or even like a solid, some sort of solid obstruction, it's going to be the same thing. They're going to have that consistent cough. Their respiratory rate is going to go up. Their lips are going to go blue, right? So even something like croup, you know, or asthma, anaphylaxis, right? It's all going to be the same. They're going to have that increased respiratory rate, some blue lips, that kind of thing. So learn how your baby breathes, okay? Do we have any questions on babies breathing?
Oh, we're still good to go.
Perfect. So my wife is saying no, there are no questions. So the next thing we're going to learn is infant CPR, okay? An infant CPR is actually quite simple, okay? The first thing we need to know is whether or not our baby is actually breathing or not, okay? You wouldn't believe how many times I've showed up on scene, okay, 4 in 18 years, where I get called for a cardiac arrest, and I show up, and the person who's in cardiac arrest is on the floor getting chest compressions done on them, but they're looking at me walking in the door, and some of them were literally talking to me, okay? Obviously, if you're able to look at me and talk to me, you do not need chest compressions, okay? The person you're doing chest compressions on does not need chest compressions. Please don't. Just don't. It's not cool, okay? But what we want to do is we want to check, the first thing we're going to check is LOC-ABC, okay? That's a really easy acronym to remember. LOC-ABC, okay? Level of consciousness, airway, breathing, circulation. Okay, so level of consciousness, obviously. So if we come across our baby, I'm gonna put a little scenario together. Okay, let's say we're upstairs getting ready. It's date night. We're all excited. We're going out, getting away from the whiny little kid. Okay, and we come downstairs, and you know he's laying in the middle of the living room floor, and he looks like he's sleeping, but it's not nap time. He wasn't tired before. He's laying there. He's motionless. He's either sleeping or he's unconscious. We're not sure. Okay, the first thing we're gonna do is we're gonna check his level of consciousness. Is he sleeping or is he awake, right? All we're gonna do, it's very easy. We're just gonna call his name and tap his shoulders. We just wanna try and wake him up, right? Billy, 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 wake up, buddy, wake up, okay? Does he respond? Look at little Billy as you do that, okay? Look at his eyes, look at his legs, his arms. Does he move? Does he open his eyes? Does he squint? You know, if there's any kind of signs of life, we know that he's just, you know, he might just be sleeping, okay? But if there's no movement at all, we know little Billy is unconscious, okay? So for the sake of this scenario, little Billy is unconscious. We cannot wake him up, okay? Now the next thing we want to do is check his airway, okay? And all we're going to do there is we're going to do a head tilt chin lift, okay? And take a quick peek in his mouth, make sure there's nothing laying in his airway, obstructing his airway, okay? Now, the reason why we do this head tilt chin lift, okay, is we're putting the airway in a more anatomically correct position, okay? So when we tilt the head back, okay, now imagine his trachea, his windpipe, is the size of his pinky finger, okay? That's very small, okay, especially in an infant, right? And so when an infant's unconscious, they're not controlling their airway very well, okay? So when their head's down like this or off to the side, their airway, you know, there might be a little bit of a kink in it. You know, I just imagine that, right? So when we tilt the head back like this, we're unkinking that airway. Okay, we're just opening it up a little bit better, okay? And then when we do the chin lift, okay, we're literally grabbing the chin and pulling it forward like that, okay? The reason why we do that is because when people are unconscious, all our muscles tend to relax. Well, our tongue can actually relax to the point of obstructing our airway, okay? If you've ever heard someone snore or stuff like that, it's, you know, it's the tongue at the back vibrating, right? So people can actually obstruct their airway with that. So when we pull their chin forward, we're unobstructing the airway, if that makes sense. Okay, so head tilt, chin lift. That's how we check the airway. Take a quick peek in the mouth. Boom, nothing in the airway for this scenario. Okay, he's unconscious with nothing in his airway. His airway is open and clear. The next thing we're going to do is check breathing. Okay, now for breathing, we keep the head back. We keep the head tilted backwards with the chin lift. Okay, we're going to our ear close to the mouth, and then we're going to look at the chest. Okay. And with our ear, we're going to look, listen, and feel. Okay? So we're going to put our ear down. We're going to listen and feel for breath sounds. And we're going to look for chest rise and fall. We're going to count to 10. Okay? So it looks like this. Head tilt, chin lift. Ear to the nose, ear to the mouth. Look at the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Okay? That's all we're going to do. Now, if we see the chest go up and down, we know that little Billy is breathing, right? If we feel and hear breath sounds with our ear, we know that little Billy is breathing. Okay, this is a good thing. He's unconscious, but at least he's breathing, okay? The next thing for this scenario is circulation. Okay, now for circulation, I'm not talking about checking pulses. Okay, as parents, as lay people, you're not checking pulses. All you're going to be doing is checking for any kind of major bleeding. Okay, are they laying in a pool of their own blood? Okay. Little Billy is not. Perfect. If they are, just grab a clean towel and just put a lot of pressure on the spot. Okay, that's all you can do to really stop the bleeding. Okay, call an ambulance. Okay, so for this scenario, little Billy, he's unconscious. Okay, he's breathing, which is good. Okay, and his circulatory system is intact. Perfect. Okay, if you ever run across this scenario where you find your baby unconscious, but at least they're breathing, okay, don't overthink it. Okay, there's not a whole lot that you can do as a parent. Okay, just call an ambulance. Stay close by, watch their airway, monitor their airway, make sure they stay breathing, okay, and just call 911 and then we'll come and we'll take care of it. Okay. So that's the first thing we want to do is we want to check, do they actually need CPR? Okay, so this little gentleman here, he did not need CPR because he was breathing. Okay, now if we're going to rewind the scenario a little bit, we check his level of consciousness. Okay, he's unconscious. Little Billy, wake up, wake up, wake up. He's unconscious. We're going to check airway. Airway is open and clear. Perfect. Is he breathing? Reassess. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Little Billy is not breathing. Okay, so because he is not breathing, now we're going to do CPR. Okay, so as parents, you're basing whether or not you do CPR on breathing. Okay, as a paramedic, I base my CPR on circulation. If they're pulseless, as a parent, you base your CPR on breathing. Okay, because if they're breathing, they have a pulse. If they're not breathing, they don't have a pulse. Okay, easy enough to remember. Perfect. So for CPR, okay, we're going to do 2 breaths, okay, 30 chest compressions, okay, 2 and 30, okay, and we're going to go back and forth, back and forth. We're going to rinse and repeat, 2 and 30, 2 and 30, 2 and 30, 2 and 30, okay. Now for the 2 breaths, okay, what we need to do, we're going to do a head tilt chin lift. We're going to put baby somewhere hard, okay, so the floor or a coffee table. Okay, even a dinner table, if you can get up and over them for the chest compressions. Okay, but put them somewhere hard, not on a bed, not on a couch, not anywhere soft. Okay, the chest compressions need to be stellar. Okay, so put them somewhere hard. Okay, we're going to do a head tilt chin lift. Okay, now if our mouth is big enough, Okay, what we need to do is create a nice tight seal for our 2 breaths. Okay, so we're going to take our mouth and we're going to put it over baby's nose and mouth at the same time. If our mouth will fit. Okay, if our baby is a little bit older and our mouth is too small, we're just going to plug the nose. Then we're going to create a seal with our mouth around baby's mouth. Okay, create a nice tight seal. Okay, then we're going to give 2 small breaths. Now remember, little baby's lungs are very small. They're about this big. Okay, if that. Okay, so if we were to take a full breath and blow it into our baby's lungs, guess what? They're going to explode on us. We don't want that. Okay, so what we want to do is we just want to do a nice gentle breath in. Okay, almost like we're blowing out a candle. Very gentle, very easy, very small. Okay, we're going to see the chest go up and down. Once we see that chest go up, we can stop. That's big enough, that's good enough. Okay, so head tilt, chin lift, plug the nose, create a seal, give 2 small breaths. Nice and small. You could probably hear it with my radio there. Okay, now for the chest compressions, okay, we're going to do 30 chest compressions. We're going to do it at a rate of 100 per minute. Okay, so about every half second or so. Okay, we're going to use 2 fingers. Okay, now we need to stand up and get right over top of little baby here. Okay, you can see me okay? Perfect. We're going to get right over top. Okay, now we're going to find the nipples. We're going to go into the middle from the nipple, so the center of the nipple line, right on the sternum there. And then we're going to put 1 finger down like this. Okay, now what we're going to do is we're going to get right over top. We're going to lock our elbows. Okay, and we're going to lock our shoulder. And we're going to use our weight to do the chest compressions. Okay, we're not going to bend our elbow and use muscle like this. Okay, we're going to get way too tired way too quickly. Okay, and if we have to do CPR for an extended period of time, we're going to get too tired and it's going to become less effective. The CPR will become less effective. And so if we're doing CPR for 10 minutes, we need it to be as effective as possible. Okay, so center of the chest, right on the sternum, about a finger width below the nipple line. Okay, lock the shoulder, lock the elbow. Now when we push in, we're going to push in at 1/3 the depth of the torso. Okay, so about 3 centimeters on an infant or so. Okay, realistically, because we're only using 2 fingers and just our body weight to do it, okay, realistically, you're going to push as hard as you can. Okay, if you weigh 600 pounds, okay, take off a little bit. But if you're a normal sized human being, just push down with your body weight as hard as you can. Okay, the harder the better, to be honest. If you let up on chest compressions, again, they're going to become less effective. Okay, just imagine Billy's little heart is about this big right now. Okay, it's not this big thing sitting inside the chest. It's just this little thing. It's surrounded by a lot of soft tissue and muscle. Okay, that's what's inside the chest. It's not like when you're doing chest compressions, you're squishing it between jagged bone and it's getting pierced by bone and that kind of thing. That's not the case. It's almost like you're massaging the heart between your hands like this. Okay, and the heart is very pliable, so you're okay to push hard. Okay, so center of the sternum, lock the elbow, lock the shoulder, push at a rate of 100 per minute. We're going to do 30 of them. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We're going to do a head tilt chin lift, plug the nose, give 2 breaths. 30 more chest compressions. 1, 2, 3, 4, 5, 6, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 28, 29, 30. 2 breaths. 30 more chest compressions. Now, if your fingers get tired, that's okay. Switch it up with your thumbs. Wrap your arms around the shoulders like this and use your thumbs like this, okay? Again, lock your elbows, lock your shoulders. 1, 2, 3, 4, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. Okay. So that's 3 rounds of CPR. okay? We're gonna keep going and we don't wanna stop. We just wanna keep going until the ambulance gets to our house, okay? It's very important that we don't stop, okay? So imagine when you're doing CPR, imagine what you're doing is you're priming the pump, okay? And this is your lifeline, okay? And right now, because we're all alive, we're all above the lifeline. Now imagine you go into cardiac arrest, okay? This is your lifeline. You're straddling the line, okay? When your heart stops, it's gonna look like this. Your lifeline's gonna dip, dip, dip fairly quickly, kind of towards non-reversible after a couple minutes, right? That's not good. When we do CPR, what we're doing is we're extending that lifeline, okay? It'll dip, it'll start to dip, but it starts to dip a lot slower, and we last a lot longer, okay? I've seen patients recover. I saw one patient recover. We did chest compressions on him for 45 minutes straight, and he walked out of the hospital like 2 weeks later with no deficits or anything, full recovery, just from doing solid CPR. That's why, you know, I can't stress to you enough how important proper form is. So lock the elbow, lock the shoulder, use your body weight. Don't use your muscles. Okay, I did 3 rounds of CPR and I was already out of breath, right? So proper form is key when it comes to CPR, okay? So for infant CPR, 2 breaths, 30 chest compressions, 2 fingers, push hard, push fast, okay? I think that's it for infant CPR. Do we have any questions for infant CPR? Questions or comments?
Let me just see here. If they start to breathe when you're doing that,
Oh, right. So if we're doing CPR and baby starts to breathe, okay, we stop. That's okay, right? We do CPR, like I said, until the ambulance gets to your house, we don't want to stop unless we see signs of life, okay? If they start to kick or whine or cry, obviously we want to stop, okay? But only if we see signs of life, okay? Another thing I wanted to mention also is calling 911, okay? If you're home with your hubby or someone else, get them to call 911 right away, okay? If you're home alone, okay, you're going to do 5 rounds of CPR. Then you're going to get your phone out, you're going to put it on speakerphone, speed dial, call 911 as you're doing chest compressions, multitask, okay? Call 911, talk to 911 as you're doing the chest compressions and the breathing. Okay, it's very important. What we don't want to do is we don't want to do a couple runs of CPR, then stop, run upstairs, grab our phone, do this, do that. Okay, if we have to go anywhere, take baby with us. It's really easy. We just hold baby in our arm like this, straddle them on your arm like this, and we can actually do chest compressions as we run upstairs to get the phone. That's really all we got to do. Okay. Any other questions at all?
not so far.
Perfect.
I think we're on to CPR now.
All right. Yep. So next what we're going to do is child CPR. So like I was saying before, child CPR, hang on one second.
Yeah.
This is my child. All right. So for child CPR, all right, kind of the same rules apply. Okay. It's just a little bit different. So we still want to know whether they're unconscious or not. So we're still going to do our LOC ABC. Okay, level of consciousness, airway, breathing, circulation. Okay, Billy, Billy, wake up, wake up, wake up, wake up, wake up. Billy, Billy, wake up, wake up. Same thing, right? Billy doesn't wake up. Okay, head tilt, chin lift, check the airway, look inside his mouth. Okay, his airway is open and clear. Now we're going to assess his breathing. So we're going to look, listen, and feel for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Perfect. Okay, so little Billy, he is not breathing. So what do we do next? We're going to do some CPR. Okay, so again, the rules are going to be the same. 2 breaths, 30 chest compressions. Okay, we're going to push hard, we're going to push fast. Okay, so this time what we're going to do, we're going to plug the nose, head tilt, chin lift, plug the nose, give 2 breaths. Again, we're going to get right over top of them. Again, this time instead of using 2 fingers, okay, so now what's happened is their chest has, it's a lot more firm. If you have a baby at home right now and you feel their chest, it's nice and soft, so we can get away with 2 fingers. When they get to the child age, okay, when they get a little bit older, okay, 2 fingers is going to be, that's going to be a tough push, especially for an extended period of time. Okay, so we're going to use the palm of one hand. So we take the hard part of the palm, okay, in the exact same spot, right on the center of the sternum, okay, maybe kind of right in the nipple line there. Okay, so put our hand right on the center of the sternum. Again, get right over top, lock the elbow, lock the shoulder. We're going to do 30 chest compressions. Again, push hard, push fast. It's okay to push as hard as you can, as long as you're just using your body weight. Don't force it, okay? Use your body weight to push as hard as you can, but we're gonna do it at a rate of 100 per minute, okay? So, 2 breaths. Hand in the center, 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 30. Head tilt, chin lift, plug the nose, 2 breaths. 30 chest compressions. 1, 2, 3, 4, 5, 6, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt, chin lift, 2 breaths. 30 chest compressions. 1, 2, 3, 4, 5, 6, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28, 29, 30. Okay. Whew. As you can see, it gets very tiring. Okay, so again, proper form is key. If I was bending my elbow there and using muscle, I would be even more tired. Okay, so lock your elbow, lock your shoulder, get right over top, use your body weight. Okay. But again, the same rules apply. 2 breaths, 30 chest compressions at a rate of 100 per minute. Push as hard as you can. Okay, it's always going to be 1/3 the depth of the torso. Okay, so that, I know that sounds pretty deep, but that's what we got to do. Okay, as your kid gets older, okay, when they're 9 years old, their chest is going to be fairly stable. Okay, so what happens is you're going to start feeling, you've all heard of that snap, crackle, pop that everybody talks about when they're doing chest compressions. Okay, there's nothing wrong with that. That just means you're pushing hard. You're pushing nice and hard. Okay, that's normal. You're going to feel that, especially as they get older, especially into adult age. Okay, snap, crackle, pop is a good thing. It will go away, okay, once the chest gets soft enough. Okay, what you're doing is you're not breaking ribs. Okay, you're not breaking ribs and then sending these ribs through the heart and the lung and causing all this trauma. Really, all you're doing is, imagine you have a rib cage and you have your sternum, okay, and attaching your ribs to your sternum is cartilage, and all you're doing is you're popping those ribs out of the cartilage. That's all you're doing. Okay, you're just popping cartilage there. Okay, you're not really doing a whole lot of trauma, so it's okay if you feel that snap, crackle, pop. That's normal. That's a good thing. That lets you know that you're pushing hard enough. Okay. Is there any questions on child CPR?
No questions so far, but I'll climb in just for a second. No, it's okay. You don't have to take that off. There's no questions so far, but if you do have questions and you are watching this on the replay, then make sure that you comment below so that Craig can get right back to you and comment, reply to your question. All right, so I think we still have some more to go, so I will pop back off and yeah, go ahead.
Perfect. Okay. All right. Excuse me. So next thing we're going to do is infant choking. This is probably why most people are watching this video right now. So infant choking is kind of the thing I get asked the most.
I was supposed to be Vanna White and grab that for him, but I forgot.
She's slacking. Slacker. All right, so infant choking. Okay, and we kind of brushed on liquid choking earlier on, so this is going to be more the solid choking. Okay, so with infants, well, with anybody, there's 2 types of choking. Okay, there's a partial obstruction and there's a complete obstruction. Okay, now with a partial obstruction, what we're going to see is we're going to see some sort of air movement. They're making some sort of noise with their airway. Okay, they're going to be coughing, wheezing, or crying. Okay, either way, air is going in and out of the lungs. This is a good thing. Okay, this is what we want to see, air going in and out. I know they're in distress, but hey, air is going in and out. Okay, what we don't want to do at this time is this. What every parent wants to do, okay? Please don't. You might have done it before and it might have worked to get that object out. Awesome, okay? But what you're actually doing is if there's an object stuck in their throat and you're banging on their back, there's a good chance you're gonna just jiggle it down even further if it's in the wrong spot. And now that partial obstruction is gonna turn into a complete obstruction, okay? That's what you don't want. Our babies, our kids, us, we have a cough reflex, we have a gag reflex, right? Our body is very good at getting these foreign objects out of it, okay? Let us try, okay? Chances are we're gonna be able to get it out ourselves, okay? We've all seen it before. I'm sure it's happened to our babies already before. I'm sure it's happened to us before. We kind of choke a little bit and they cough it out. Perfect, okay? Remember to assess their breathing even after they choke on something solid like that, even if it's just for a second. Assess their breathing, like I was mentioned earlier in the program. But with a partial obstruction, as long as we can hear noises, right? As long as air is going in and out, don't touch your baby, okay? Stay calm, okay? If you get anxious, they're gonna see that anxiety and they're gonna get anxious, okay? So we wanna stay calm, and all we wanna do is encourage them to cough, okay? You got it, Billy, cough it out, buddy. Cough it out, you got it, buddy. That's all we're gonna do, stay calm. They're already anxious enough, we don't need to add to it, okay? If they can't get it out, okay, I get this asked a lot, you know, how long is too long before we wanna call an ambulance, okay? Realistically, I don't know when you get scared, okay? If they're choking on it and they can't get it up within a couple coughs, okay, within 5-10 seconds, get on the horn, call the ambulance. You're not doing anything anyways. Remember, you're not touching your baby at this time, right? So call an ambulance right now, get us rolling. There's nothing wrong with that. There's nothing wrong with having us come right away, okay? Because once it becomes a complete obstruction, then our hands are full. Now it's harder to call 911. So if they're coughing a little bit and it's not coming out, okay, call an ambulance right away, okay? But partial obstruction, don't touch them, okay? If that object becomes a complete obstruction, okay, so now there's no air going in and out. Now their lips are turning blue, the face is going red, they have that death look in their eyes. You know, they're sucking air, they're trying to anyways, right? Nothing's going in, nothing's going out, there's no noise. Now this is when we need to jump to action. Okay, I'm just gonna move this table out of the way here. Whoops. So, the first thing we want to do, now remember, our baby is still conscious at this time. They're still awake at this time, okay? They're just not breathing. This is very scary, okay? So they're going to be struggling. So we need to make sure we get a really good grip on our baby and we don't drop them. We don't let them flail out of our hands. We just want to make sure that we hold and we're able to do what we need to do no matter what, okay? So the first thing we're going to do, we're going to straddle baby on our arm like this. On our forearm like this, okay? The easiest thing to do, if you want to stand up and do this, great. I suggest sitting down because you can get a little more leverage hanging off your knee here. So you're going to rest baby on your elbow on your leg. You want them on a 45-degree angle outwards like this. Oh, my bad. We got to flip baby over, sorry. We're flipping baby over onto the stomach is the first thing we do. Same thing, get on your knee, rest your elbow, 45-degree angle downwards. Okay, gravity is our best friend right now, okay? We want gravity to work with us, not against us, okay? So 45-degree angle downwards. Lay them kind of across your body. Take the palm of your hand and right between the shoulder blades, okay? We're gonna do 5 hard back blows. 1, 2, 3, 4, 5, okay? Nice and hard, okay? This isn't gonna work. And I know parents were scared to hit our babies in the back, but what I always say, you're not gonna break your baby doing that. Remember, they're choking to death, right? What's worse, a bruise on the back or them choking to death, right? Life or death here, people, okay? So, right between the shoulder blades, 5 hard back blows. 1, 2, 3, 4, 5, okay? We're going to sandwich them. We're going to flip them over and rest them on. We can rest them on our knee again. Okay. 45-degree angle downwards. 2 fingers. Same place we did chest compressions before. We're going to do 5 chest compressions. 1, 2, 3, 4, 5. Sandwich, flip over. 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 1, 2, 3, 4, 5. Okay. With the back blows, sorry, we don't stop doing any of this, again, until our baby goes unconscious. Okay, so we keep doing this 5 and 5 until our baby goes unconscious or until the object comes out of the mouth and they start breathing again. Okay, but don't stop. 5 and 5, 5 and 5, 5 and 5, don't stop. Okay. When it comes to the back blows, like I say, like I kind of tell my clients, you know, bruise the back, don't break the back is kind of what I allude to pretty much. So you want to do it nice and hard. You don't want to be too gentle because it won't work. Okay. I had an incident with my son. He was 18 months at the time. He comes up to me. He has a strawberry in his hand and he looks at me. He walks right up. I was standing in the kitchen. He walks right up to me, looks me dead in the eye, puts the strawberry in his mouth and just shoves it down his throat. Okay. Instant obstruction. I picked him up right away. 1 solid back blow and it popped out perfectly. Okay. This stuff works. Okay. Do this stuff. Grab a doll at home, practice with it. Make sure to pick your child up at home. See if he can do this like this. Okay. If your child is too heavy for your arm like this, that's okay. Sit on a chair and just lay them across your lap. 1, 2, 3, 4, 5. Flip them over. 1, 2, 3, 4, 5. Rinse and repeat. Okay. It's never going to be smooth like it is with a doll. There's going to be some, you know, adjustments there and stuff, but practice. Okay. Pick your kid up, practice it at home. Know what you can and can't do at home. So if the time ever comes, you know exactly what to go to right away. Okay. For conscious and choking, it's 5 and 5. 5 back blows, 5 chest compressions. Okay. Until our baby goes unconscious on us. Okay. Now, if our baby goes unconscious on us, I'm just going to put this table back right here. Again, we're going to put our baby down somewhere hard. Again, like a coffee table or the floor. Okay. And we're just going to resort back to CPR. Okay. Only this time with CPR, a little bit of a change up here. Okay. So this time, again, with our breaths, we're going to do a head tilt chin lift, plug the nose. This time we're going to give 1 small breath. Then we're going to readjust the airway. Now we're going to give a 2nd small breath. Okay. The reason why we readjust that airway in between is because there's an obstruction there. Okay. When we give that first breath, we're probably going to feel some resistance at the mouth and we're not going to see the chest go up. And that's okay. That's not okay, but that's expected. Okay. Because of that obstruction, but we still have to try. So we readjust that airway. Maybe that adjustment is enough to kind of kick it loose or kick it to the side. Now we can maybe get the 2nd breath in, if that makes sense. Okay, so 2 breaths again. Now we're going to do 30 chest compressions again. So we get right over top, right? Thumbs on the middle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Head tilt chin lift, give 1 breath. Readjust the airway, give another breath. 30 chest compressions. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. Perfect. And again, with CPR, rinse and repeat. We just keep doing it. Okay. 2 breaths, 30 chest compressions. Okay. Until we see signs of life or until the ambulance gets to our house. Okay. One more thing I wanted to add on when it comes to calling 911 during a choking incident. Okay. Like I was saying before, if it's just a partial obstruction and you get scared, call right away. Nothing wrong with that, okay? If you don't call right away, or if it goes a complete obstruction right away, what you want to do is you want to do your back blows and you want to do your chest compressions, okay? Then they go unconscious. Now you want to do 5 rounds of CPR again, okay? Then you grab your phone and again on speed dial, speakerphone, 911, call 911 as you're doing the chest compressions, as you're doing CPR, okay? You always want to wait till you've done 5 rounds of CPR. The reason for that, the reason why we don't call right away if we're by ourselves is because this stuff is very effective, especially with the choking, with the back blows and the chest compressions. It's very effective. You're probably going to be able to deal with it yourself, okay? I've been a paramedic now for 18 years, and out of all the choking incidences that I've gone to, 99.9% of them have resolved themselves before I even step foot in the ambulance, okay? So because our dispatch is just going to tell you what to do anyways, and you're going to do it and it's going to work, okay? I'm not going to guarantee it, but it is very effective, okay? I've seen it work a lot of times on people, okay? So deal with it yourself before you call an ambulance, because time is tissue, as we say in EMS. So with infants choking, okay, if they're conscious and choking, 5 and 5. When they're unconscious and choking, 2 and 30. 5 and 5, 2 and 30. All you gotta do is remember those numbers and you're set, okay? Now, if they're unconscious and we're doing CPR and chest compressions and we come up to the airway, okay, and we see the object. Once we see that object, perfect, that's what we wanna see. We've cleared the airway, so what we're gonna do is we're gonna pick baby up like this. And we're gonna hold them on their side, again, on a downward angle like this, okay? Gravity is our friend. We're gonna take our pinky finger and we're gonna do a nice gentle finger sweep from top to bottom. And we just wanna clear that airway out, okay? Get that object out because we don't want them re-choking on it, okay? Now, if our baby stays unconscious, okay, they don't wake up, the obstruction is gone, but they're unconscious and they start to breathe on their own again, excellent. All we're gonna do is just hold them like this, okay? And we're just gonna make sure they stay breathing until the ambulance gets to our house, okay? If we get the obstruction out and they don't start to breathe on their own again, okay, now we just put them down back on the table, and again, we continue with CPR, 2 breaths, 30 chest compressions, okay? Any questions on infant choking?
Give them a minute, see if there's anybody has some questions. No questions so far.
Perfect. No questions. Moving along. Okay, so the next thing we're going to cover is child CPR. Sweetie, do your job.
No. Vanna's coming.
Yeah, Vanna, do your job.
Did that work?
Perfect. Okay. So child choking. Okay, so again, with children, it's the same thing. There's 2 types of choking. There's a partial obstruction and there's a complete obstruction. Okay, the partial obstruction, again, they're coughing, wheezing, crying, making some sort of noise. Okay, again, don't touch them. Just encourage them to cough it out. Okay, if they're an older child, they're 9 years old or whatever, or even an adult or whatever, right? And they're kind of hacking it up. One of those, they might get embarrassed, right? They might get embarrassed. They might want to get up from the dinner table and leave. Okay, just follow them wherever they go. Don't let them go behind a locked door or a closed door or anything like that. Follow them where they go. Stay calm. Okay, and just encourage them to cough it out. Okay. If it becomes a complete obstruction, okay, so again, complete obstruction, there's no air movement, there's no airway noise, okay, their lips are turning blue, the face is going beet red, they got that death look, you know, and they have that universal sign of choking. One of those, right? What we want to do is, this is kind of when we jump into action. Okay, so the first thing we're going to do, let's see here, this table aside. You should be able to see there. The first thing we're going to do, we're going to get down on one knee, okay? We're going to grab our little fella, and we're going to bend him over our knee like this. Okay, let's make sure I can do it. Yeah, we're going to bend him over our knee like this. Again, try and have him facing downward on a bit of an angle. It helps out, okay? So have him facing downward. We're going to find between the shoulder blades again, and we're going to do 5 more back blows. 1, 2, 3, 4, 5. Okay? Pretty hard. The older they are, the more stable their back is, the harder you could probably do it, okay? But don't let up. Even if it's just a 3-year-old, you still don't want to let up, okay? Nice and hard. 1, 2, 3, 4, 5, okay? Then we're going to stand them up. And sorry, this microphone might get in the way here. We're going to stand them up like this, okay? We're going to squeeze them against our chest, okay? They're standing, we're on our knees. We're going to squeeze them against our chest, okay? We're going to take our left hand and we're going to make a fist sideways like this. We're going to put our fist over the belly button, okay? Then we're going to take our other hand and put it right on top. And we're going to do 5 abdominal thrusts, okay? 1, 2, 3, 4, 5, okay? So when it comes to the abdominal thrusts, we're actually going in and up like that. It's actually a J thrust. In and up, in and up, in and up, in and up, okay? We want to do it fairly hard, okay? Like I say, try and lift their feet off the ground, okay? A nice little gentle one isn't doing much. We're trying to create enough force by pushing that diaphragm up and then being able to create force inside the lungs and expelling the object out. Okay, that's kind of the idea behind it. So we need to do it nice and hard. Okay, now if you were to do it to yourself, like that, like it's even just a little bit, it's very uncomfortable. So they're not gonna like it because you're trying to do it about 10 times harder than you can do it on yourself. Okay, your kid is not gonna like it. They might try and run away from you. They might try and, book it somewhere. Hold on to them, grab them. Remember, they're dying right now and you got to save their life. You got to do what you got to do. Okay, so 5 back blows. 1, 2, 3, 4, 5. Put them up. 5 abdominal thrusts. 1, 2, 3, 4, 5. 5 back blows. 1, 2, 3, 4, 5. 5 abdominal thrusts. 1, 2, 3, 4, 5. Okay, so, and we're just going to rinse and repeat that. Sorry. 5 back blows, 5 abdominal thrusts, and we just keep going with that. Okay, remember they're conscious at this time, and we're going to keep doing that until they go unconscious. Okay, now if we're at home with our hubby, obviously our hubby has called an ambulance right away. Okay, but if we're by ourselves, remember we still haven't called an ambulance. We want to try and do this ourselves. Okay, so 5 and 5 until they go unconscious. Now, when they go unconscious, we want to make sure that we lay them down on the floor nice and gently. Okay, we lay them on the floor gently. And now, same thing as before with CPR. Okay, head tilt, chin lift, plug the nose. 2, 1 breath. Readjust that airway. Give another breath. 30 chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Head tilt, 1 breath. Readjust that airway, give another breath. 30 chest compressions. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. I am tired. Okay, so conscious and choking, 5 and 5. Unconscious and choking, 2 and 30. Okay, now when we're doing CPR, again, if we come up to the airway and we see that object at the top of their mouth or sitting in their mouth, what we want to do is we want to, kind of hard to show you guys from here, but we want to roll our child to the side. Okay, all we're going to do is we're going to grab their shoulder and grab their hip and roll them towards us. Okay, take our pinky finger and from the top to the bottom, we do a nice gentle finger sweep to get it out. Only if we can see the object. If we can't see the object, we never put our fingers in the mouth. Okay, so now that we've cleared the airway, are they breathing again? If the answer is yes, they are breathing, perfect. We can keep them in this position, okay, laying on their side. We just bring their top knee up, okay, just bend their top knee and they can actually lean over on their top knee and they can kind of stay in this position, okay. If they don't start to breathe on their own again, we just put them back down on their back, and now we continue with regular CPR, 2 breaths, 30 chest compressions, okay?
Just double checking that. Looks like it froze for a sec.
Oh. Okay.
Okay, no, you're good.
Okay, we're good. Okay, so that is child choking in a nutshell. Any questions on child choking?
Give them a minute here.
So we've done breathing assessment, infant CPR, child CPR, infant choking, and child choking. The only numbers you need to remember today are 5 and 5, 2 and 30. 5 and 5 when they're conscious, 2 and 30 when they're unconscious. Okay, I've actually wrote down, these are kind of the general rules for CPR. Okay, if you want to screenshot that or write it down, okay, hopefully the ring light's not reflecting on it. Okay, but those are the rules for CPR. 2 breaths, 30 chest compressions, create a nice tight seal, slow and small breaths. Okay, infant CPR is 2 fingers, child CPR is 1 palm, rate of 100 per minute, 1/3 depth of torso, push hard, push fast. Okay, that's what you got to remember. Okay, make sure to get right over top when you're doing it and use proper form. Proper form is key. Okay, so those are the rules.
All right. Looks like there's no questions so
Perfect.
far.
I'll give this back to you.
Yeah, maybe just for a sec here. You can stay right there. There we go. So what did you think of tonight's training? Did you find this helpful? Did you find this valuable? Let me know in the comments below or in the chat. And yeah, I mean, thank you so much for being here.
No
if
problem.
you do want to...
He's going to be here anyways.
He's always here. Well, maybe not always. But if you do want to check out Craig's website, it is TinyTotsCPR.com, and his email is TinyTotsCPR@gmail.com. So maybe some mummies and daddies, they like to maybe invite the family over. They like to do one-on-one. Craig does it on Zoom calls. So that's just basically like a Skype session.
And I will add that my online course and the in-home course is actually 2 hours. There is quite a bit more that I do add on to it, including like full head-to-toe assessments of your baby, what different signs and symptoms mean, along with a bunch of other stuff as well. So just so you know.
Yeah, and some parents like that one-on-one where that he can actually see you online, where it's, two-way, and he can watch you do it and then you ask the question. So some people will find this is sufficient and they love it, and then some people want to dig a little bit more. So, everybody has their own situation and maybe they want to ask a few more questions not on this live. So with that said, we do have some time a little bit. There's another comment. I'm just going to... Very helpful. Thank you so much from a mommy of 7 kids, Angie. Wow, maybe you can give some tips also how you do it with 7 children, because we have 2. We have a 16-year-old and a 4.5-year-old, and I literally say to him every day, how do people do this with more than 2 kids? I will never know. 7 kids, that's amazing. I'd love to know how old they are, because that's incredible.
The factory is shut down.
Yeah. Well, I'm getting up there. I'm not a spring chicken anymore, so yeah. And I mean, most people know that I've gained actually 54 pounds with my last baby, and actually 55 with my first, and I'm only 5 feet tall, so that 55 pounds was a lot, and it took some time to get down. So, I mean, that's why I'm here. So, with that being said now, if nobody has any more questions, please share the heck out of this video. Hit that share button and get it out there on your social media. Get it out there on, to your friends, your email, like text, whatever you can, so that we can help as many people as we can. I don't know how Craig does it, being a paramedic. I give him credit because we need paramedics, and it's a hard job. It's not an easy job. I don't know how he does it. We actually joke that I would be so fired the first day if I was ever a paramedic, because I'd want to know, like, what happened to little grandma? Like, I want to know, is she okay? Like, what happened?
We don't usually follow up with our patients a whole lot. Unless it's like a really interesting case or like some sort of major trauma, I'll follow up. But most of my patients, we just kind of leave them and go. We can't bring too much, we can't make it too personal in our job. Or else we do get burned out. So.
But I make everything personal, and I'm super emotional and super sensitive, and I just want to help everybody, and so that I would just be fired. And when I first said that to Craig, he's like, yeah, you would. And the other reason why is I'd probably be crying. Like, I'd go to a call and I'd just be crying all the time. So I'm so not cut out for that. So it takes a special kind of person to do what he does. So thank you so much for joining us.
No problem.
And don't forget to hit that like button too. And then if you want more different trainings and maybe special guests on my channel, then I'm happy to do that. Be sure to click that subscribe button if you haven't done so already, and click that notification bell so you are notified of these lives and of more videos. And if you have some ideas that you would love to see on the channel, I'm very open to everything. So there's going to be more videos even just this week. So make sure you comment below, and then I'm just going to double check and see. I crawl over to my laptop because I have my phone turned away, so just 1 second, I'll double check. Oh my gosh. Angie, oh my goodness, 19, 16, 13, 11, 9, 5, and 15 months. You deserve a crown on your head because, wow, like that's a lot of children, like 15 to 19. You know, this is fun, 15 months to 19. And what's funny is when I was pregnant with Preston, with my 4.5-year-old, when I was pregnant, my oldest was 12, not even 12 yet. And he was like, so when I graduate, how old is the baby going to be? And I thought about it for a minute and I went,
just starting.
Well, yeah, he's going to be in grade 1. And then I had to take a break for a minute and go,
you were almost in the clear. You were almost in the clear.
Let's talk about that for a minute.
When
What?
Screwed that up, didn't you?
So yeah, that was pretty crazy. So kudos to you, man, because that is amazing. Yeah. Factory's locked up for you too. Yeah. After 7, I just don't even know. So thank you so much for joining us. We hope you found a lot of value, and we will see you next time.